Good morning, everyone. It's 11 o'clock, so we'll go ahead and get started. I want to welcome everyone to another Rock County Public Health Department media briefing. These briefings are being streamed live on the Rock County Public Health Department Facebook page, and the recordings are available afterwards on our Facebook page and on our YouTube channel. So we usually start with some remarks from the Rock County Public Health Department, and then we turn it over to our media participants for the opportunity to ask us questions. My name is Jessica Turner. I'm the communications specialist for the Rock County Public Health Department. And today with me, we have Katrina Harwood, health officer, Nick Zupan, epidemiologist, and Seth Longcar, administrative services supervisor. So we'll go ahead and get started with the remarks from the Rock County Public Health Department. And we'll start with Nick with some data updates.
All right, thanks, Jessica. So in terms of our COVID-19 case activity, we've seen a pretty drastic decrease. We are seeing pretty low numbers in terms of our cases. So we're at 16,380 total cases over the course of the pandemic, but over the last week, we've seen an increase of only about 27 additional cases. And so that gives us an average of about 4 new cases per day over the last week. So we continue to see our daily average number of new cases declining. Right now, we're looking at about 139 active cases in the community, and there have been 180 deaths due to COVID-19. Most recent counts for hospitalized patient is six currently in the hospital getting care for COVID-19. And in terms of our vaccination rates, we've vaccinated 47.5% of the Rock County population with at least one dose. And we've gotten 41% of the Rock County population fully vaccinated. So ongoing increases in the vaccine rollout. And then one additional update that I wanted to share related to the data. We will no longer be updating our reporting on the weekends. So we have a daily report that we update every day, and we're no longer reporting our daily new counts on the weekends. We will continue to update our report on the weekdays. And this move is in conjunction with the Wisconsin Department of Health Services announcement that they are no longer updating their data reporting on the weekends as well. So we're following their lead there. So we'll continue, as I said, to update our data reporting each day of the week. So that's all I have for updates. Back to you, Jessica.
Thank you, Nick. I will turn it over now to Katrina.
Thank you, Jessica. Today, we want to focus on our ongoing priorities related to the pandemic. While we are moving forward in a very positive way, the pandemic is not yet over. We have been fortunate. Not all countries or regions are in the same place we are today. We want to thank everyone in Rock County who has continued to follow the recommendations set to help control the spread of COVID-19. We are at a better place today due to the collective efforts and action of people who live and work in Rock County. And we must continue to remain diligent to ensure this progression and progress continues. So what can we do to make sure Rock County stays healthy and open? First, we will continue to do all we can to ensure as many individuals as possible are vaccinated. This is the best tool in our arsenal against the spread of COVID-19 and a future resurgence of the disease. In just a few minutes, we'll share some additional community vaccination clinic opportunities we have planned over the next few days to help make this process even more convenient for Rock County residents. Second, we want to strongly encourage anyone exhibiting COVID-19 symptoms to get tested. This is as critical now as it was at the height of the pandemic, maybe more so today. Testing is the best way we can track any current spread and move to stop it immediately before it becomes a larger problem. We have an opportunity now, with COVID levels low, to very effectively contact trace and put a stop to outbreaks before they become unmanageable. Testing is the way we can stay open and manage COVID-19 going forward. If the vast majority of Rock County residents commit to vaccination as well as widespread testing, we will see COVID-19 morph into more flu-like disease versus the tragic and unprecedented progression we experienced in 2020. We would also like to mention that home test kits are now widely available and can remove some of the barriers to testing, making the process more convenient and simple. There are two types of COVID-19 tests that test for active disease. This includes a PCR test and an antigen test. Not all tests are created equal. Please keep in mind that the antigen tests are less reliable than the PCR tests and should be confirmed with a follow-up test to ensure accuracy. If you get a positive result from an at-home test, please stay at home and away from others. Please notify any contacts who you may have exposed, and please contact your doctor to find out if you need a confirmatory test. If you don't have a doctor, you can call the health department at 608-757-5440. Please help keep us moving forward. We have a chance to make a real difference right now to ensure we're all as healthy as possible going forward. It has been wonderful to watch the joy that comes with reopening, spending time with our family, friends, neighbors, and getting back so many of the things that we all missed in 2020. We want to be sure we are doing all we can to continue moving forward to that reality. We need and appreciate your support, and we're all in this together. I'll pass it back to you, Jessica.
Thank you, Katrina. I'm going to turn it over now to Seth, who's going to talk a little bit more about those community clinics that Katrina mentioned.
Great. Thank you, Jessica. To help increase access to vaccinations, as well as the percentage of vaccinated individuals in Rock County communities, we have been partnering with local schools, businesses, and pharmacies to hold community clinics. Two of the recent clinics were held at Clinton High School on May 27th, and Beloit Head Start on May 30th in partnership with Walgreens. Approximately 60 more individuals received their vaccination within these two clinics. This was in addition to nearly 700 vaccinated at prior clinics. On May 18th, there was 251 people vaccinated at Evansville High School, 176 at Milton High School on May 19th. Edgerton High School had 203 vaccinated on May 20th, and Orfordville's Parker High School vaccinated 61 people on May 26th. We have some upcoming clinics as well. There are many other community clinics hosted by Rock County providers. To secure a vaccination, please visit. Today, you can visit Edgerton High School, Thursday, June 10th from 2 p.m. to 5 p.m. Vaccines will be offered to individuals ages 12 and up. Edgerton High School is located at 200 Elm High Drive in Edgerton. Walk-ins are certainly welcome. Masks are required, please. Minors should be accompanied by a parent or guardian, but if this presents a hardship, they will allow signed consent forms. Consent forms can be requested by emailing covid19.questions@co.rock.wi.us, or also you can call 608-352-6727. Individuals may also call 211 if they need a ride to their vaccination appointment. Also, St. Thomas Church Vaccine Clinic hosted by Beloit Fire and EMS from 4:45 to 5:45. This will be this Saturday, June 12th from 11:45 to 12:45, and on Sunday, June 13th. St. Thomas Church is located at 822 East Grand Avenue in Beloit. Vaccines will be available for those ages 18 and up. Masks are required. Second doses will be provided June 10th through 11th. Please call 608-364-5711 to register. Registration is recommended. If limited mobility is a barrier, please let registration know and they will try and connect you with a ride. To find additional details and more vaccine clinic opportunities, please visit rockcountyshot.com/locations. Rock County Shot also offers a wealth of general COVID-19 and vaccination information. It is a frequently updated cooperative effort targeted at Rock County residents to help match residents to vaccine resources. Also, for homebound vaccinations, we want to reiterate that Janesville is now vaccinating people who are homebound. Anyone who is homebound and lives in Janesville, in the Janesville Fire and EMS area, is eligible for this service. Caretakers of a homebound person can be vaccinated at the same time. Please call 608-352-6727 to schedule. The goal of the community clinics and homebound program is to ensure every individual interested in getting vaccinated or vaccination has the opportunity to do so. We will continue to seek out partnerships like these to increase the percentage of Rock County individuals who are fully vaccinated. And that is the end of my update. I will turn it back to you, Jessica.
Thank you, Seth. And I just wanted to reiterate those upcoming vaccine clinics we have today at Edgerton High School, starting at 2 o'clock until 5 p.m. And then this weekend at St. Thomas Church, and that's on Saturday at 4:45, Sunday at 11:45. So that concludes the health department remarks. So we will now turn it over to the media for some questions. And it looks like we have one participant today. We have Jonah from Janesville Gazette. And so Jonah, we will go ahead and give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Wonderful. Thank you all for being here and for doing this. I have not been one of the reporters to tune in before, but I know that my coworkers have been appreciative in past weeks nonetheless. So with the big announcement last week about discontinuing the phase reopening plan, I'm just starting generally in terms of how have things been since Tuesday? Are you noticing anything different at all?
I can certainly start. In terms of the case activity, we continue to see very, very low numbers of new cases being reported to the health department. As I said, on average, it's about 4 new cases per day being reported. We're also tracking hospitalized patient counts, and we haven't seen any kind of drastic increases since the retirement of the reopening guidance. So all signs are positive right now. We'll continue to monitor the data and the case activity moving forward. But hopefully, in addition to kind of boosting vaccination numbers, we'll see lower and lower COVID case counts.
And if it is just me, I was like about 30 seconds late, and I missed the beginning of the numbers presentation. Nick, would you be able to just run through some of those data that you just alluded to one more time?
Sure, no problem. So over the course of the pandemic, we've had 16,380 Rock County residents test positive. The weekly increase has only been 27 new cases. Like I said, four new cases per day on average over the last week. There have been 139, or there are currently 139 active cases, and there have been 180 deaths due to COVID. 6 patients currently getting care in the hospital for COVID-19.
Thanks much. And so my coworker, Frank, was tuning into a school board meeting, and a school board member kind of had a complaint that the guidance change wasn't very clear. And I'm thinking that she was referencing, places can fully reopen, but places like schools still have requirements at the time, so follow those. So rather than, I guess, making a suggestion for what the schools should do, what's your response to a critique like that I'm sure, you've kind of gotten a lot of critiques from a lot of different directions over the last several months and last year or so, but how would you respond to that point?
Yes, thanks for that question, Jonah. For schools, we've continued to provide them with the guidance that CDC has for schools to safely reopen. So that is what we've been providing to school superintendents as they have made plans for their schools. We do recognize that sometimes, we have opportunities to further develop partnership with other organizations and other decision makers in the county. So we see that feedback we received in the article as an opportunity to improve communication with the school district boards. But again, we are encouraging schools to continue to follow CDC guidance, which does encourage mask wearing and distancing.
Thank you. Just a couple more here. Do you think that there's is there any conflict in the communication style with this idea of discontinuing the reopening plan and still wanting people to follow guidelines X, Y, and Z? So why choose the discontinuing rather than, we'll move on to the next phase, for example?
Yeah, thanks for the question. It helps streamline communication for us, and it helps us ensure that we are following the most current recommendations. What we found is that delays can be created if we were to maintain our own guidance. If we maintained our own guidance and CDC recommendations changed, then we would go through a process of updating our guidance. So again, there would just be a delay in getting that updated guidance out to the community. So we feel at this point in the response, with how things are going, by response I mean pandemic, based on how things are going, we feel like it's a little bit more of a streamlined process to refer to CDC guidance for Rock County at this time.
Thank you much. And the last one, and one I'm sure you guys have been thinking about and probably talked about over the last maybe several weeks, but how do you, this next wave of vaccinations where it's maybe less people, the people who really want them, and not everyone, but most people are able to have access to vaccines. How do you target people who are maybe vaccine hesitant or just haven't gotten around to it to kind of keep the numbers going in a positive direction for more people getting the vaccine?
I can answer that one. So we're shifting a little bit from getting people to the vaccines to rather getting the vaccines to the people. So we are trying to make things more convenient for people who maybe have not had the opportunity time-wise, in their schedule or things like that, to go out and get a vaccine. And we understand that people do still have questions. There are still some people that that maybe need some answers. We encourage everyone to reach out to their healthcare provider if they have questions, and get those answers before they make their decision to get a vaccine or not. So we're trying to make things as convenient as possible for people by providing those community clinics in locations that hopefully are convenient for those who still need to get vaccinated.
I think that that covers it for me. So once again, thanks a lot, everyone. I really appreciate it.
Great, and thank you, Jonah. Thank you for participating. So that concludes our media briefing for today. I want to thank everybody who's been watching on the live stream and everybody who will be watching the recording of this. And we will be back in 2 weeks for our next media briefing. Thank you, everybody. We'll see you then. Be safe and be healthy.